bit more help for this speech. My speech is going to be about advocating for your rights with your medical care. An essential part of your medical care is advocating for your rights. And to do this successfully, you need to be informed as well as vocal about your needs or the needs of a loved one. From personal experience, my mother got really sick in 2016 and ended up in the hospital. She was diagnosed with leukemia, acute myeloid leukemia, and there was a protocol that was put in place, as there is for any diagnosis. And it was just, this is what we're going to do. And, at first we didn't ask any questions, we didn't challenge the doctors, and we just went with the flow. My mom ended up getting very sick and ended up in the ICU, and her oncology nurse from the group that she was seeing to be treated played an integral part in her care. She kept us very well informed, and she helped us advocate for things that my mother needed while she was incapable of doing this herself. So you need to be knowledgeable about your doctors or nurses and your medical needs. First off, you should find a provider that will spend the time to listen to your needs and get to know you and what your concerns are, whether it's what your medical concerns are or it's your concerns with the treatment and about the system. You need to be knowledgeable about your needs, because you know what's best for you, you know your body's best, and you know when something's not right. And you need to stand up for yourself when you know that something's not right. And, the old saying, the squeaky wheel gets the grease. Sometimes you have to be that way. When doctors were spoke to about, when patients were spoken to about how their doctor spoke to them about their medical information and how much they would like to be involved in their healthcare related decisions, 59% of respondents said that their doctor initiated the conversation during a visit. 55% said that they want to be partners in making their decisions. And only 10% said that they wanted to make their medical decisions by themselves. And 2% said that they wanted the doctors to make the decisions without their input. So what is really interesting is 55% of people say that they want to partner with their healthcare professional to make decisions. And to do this, you have to do your research and know about what you're going into and know what questions to ask. You don't necessarily have to be an expert on the condition. You just need to know what questions to ask. And you also have to take into consideration if a loved one or a family member, very close friend, or even a partner is facing a major illness, you need to be there for them and help them advocate for themselves as well as their medical care. When we spent a lot of time in the hospital when my mother was sick, and I was there every day and my father was there every day, and the nursing staff and the doctors took notice of that, and they knew that we would be there to ask questions, and they made themselves available for that. They also, if they know that you're going to be around regularly, sometimes it may just be an illusion, but it seems like they're more attentive. You want to have your wishes known and have a healthcare proxy or a power of attorney. This is a person that can act as you if you're unable to request medication, medical attention, or testing that you may need but are not available to ask for. It's very important to have these documents in place, as well as your wishes outlined with whoever you've designated. That way they know what you want and know how to advocate for you. According to an article that I read by Minson, an agent can make healthcare decisions for you with some limitations. This includes healthcare decisions that agree or don't agree to medical procedures or services to diagnose or treat your physical or mental condition. Your agent has to talk to your doctors before making medical decisions, and your agent can also see your medical and hospital records. Why this is so important, as we ran into with my mother's situation, she had been intubated for over 2 weeks and ended up having a tracheotomy. So when she came out from sedation, she was extremely weak. She wasn't able to vocalize. She wasn't able to speak. She was very limited with mobility, with hand gestures. She couldn't write out what it was that she wanted or needed. So it was really important that we were there and we had the authority to make requests on her behalf, as well as to request additional testing or medication. There was a time that I remember where the nurse was having a hard time getting medication through a PICC line that was put in, and they were kind of like, well, we're going to have to call the PICC team and wait for them to come up, and there's really nothing we can do at this point. But my mom was due for pain medication, as she had complications while she was in the ICU and had to have her foot and her hand amputated. And so it was a major surgery. So she needed the pain medication. And you could tell, obviously, she was agitated. It was obvious that she was agitated and that she was in pain. So I stepped in and I said, well, you're just going to have to put in another IV and get the pain medication into her. And I don't know if that's not something that necessarily would have occurred to them. They were going to follow a protocol of calling a specialized team in to deal with the PICC line. And because my mom wasn't verbalizing that she wanted the medication, that's where they were leaving it. But as I was there and I had the proxy to act on her behalf, I was able to ask for it for her. And in the end, it was something that offered her comfort. Physician sentiment on the potential of health advocates is positive. So my next visual that I have shows how physicians feel, the percentage of how they feel regarding health advocacy, improved quality outcomes, and increased drug adherence and disease management is at 42% when you have a health advocate involved. There's improved patient experience at 38%, decreased costs from increased care efficiency at 26%, decreased readmission to the hospital at 26%, and decreased inpatient length of stay at 22%, and decreased post-acute care length of stay. And this is according to PCW Health Research Institute, a clinician survey in 2018. So you can see that the numbers aren't overwhelming, but doctors and medical professionals in general are in favor for an advocate within yourself or for you for your health care. Having a nurse to advocate or someone who is in the medical profession to advocate for you can be very helpful. According to Critical Care, the role of nurses as patient advocates, their protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response and advocacy in the care of individuals, families, communities, and populations. That's what a patient advocacy for a nurse is. The other thing that you can do is you can look into societies and organizations that offer assistance in patient advocacy. This is specifically from the Leukemia and Lymphoma Society, and they offer one-on-one support in advocacy and education, information specialists, clinical trial nurse navigators, and a registered dietitian. So in conclusion, doctors are for being your own health care advocate. You have more invested in the situation, so there's more likely of a better outcome in adherence to the medical protocol that's put in place, as well as it's important to be there for your loved ones and their healthcare needs. So patient advocacy is an integral part to your medical care, to you and your loved ones. Thank you.